Hello everyone, welcome to Anima Anatomia. Today we will discuss of the thoracic aorta and its branches. So first of all, what is thoracic aorta? Thoracic aorta is the part of the descending aorta that lies within the thoracic cavity. It begins at the lower border of the fourth thoracic vertebra, T4, where it continues from the aortic arch and descends along the left side of the vertebral column. The thoracic aorta origin, that is the lower border of fourth thoracic vertebra, continuation of the arc of aorta. It terminates at the aortic hiatus in the diaphragm at the T12 vertebral column. So from aortic arch, the three major arteries going. This is the aortic arch. From here, the descending aorta, and this is the diaphragm. From aortic arch, the three major arteries are the left subclavian artery, left common carotid artery, and the brachiocephalic trunk. So the later, the brachiocephalic trunk is divided into right common carotid artery and right subclavian artery. So after the aortic arch, it becomes the thoracic aorta, which passes the diaphragm through a hole called the aortic hiatus, and later it becomes the abdominal aorta. Then we are talking of the branches of thoracic aorta. The branches of thoracic aorta are divided into two groups, visceral and parietal. Visceral to the organs and parietal to the body wall structure. So the first one is the parietal branches. Then the parietal branches are then divided into two arterial groups. First one is the posterior intercostal arteries and the second one is the subcostal arteries. So we will discuss of the first posterior intercostal arteries. They are usually 9 pairs from 3rd to 11 intercostal spaces. From here 3, 4, 5, 6, 7 and 11. From left side also same 3, 4, 5, 6, 7, 11. 3 to 11. 3 to 11, they are the posterior intercostal spaces. First one are the 9 arteries. They are running along the lower border of the ribs on each side. They run along the lower border of the ribs, that 3rd to 11th rib, and these are the posterior intercostal arteries from 3rd to 11th. The upper two intercostal arteries that come from the subclavian arteries. The upper two, 1 and 2, that coming from the subclavian arteries. The posterior intercostal artery will connect with the internal thoracic artery, which also comes from the subclavian artery. Then talking of the posterior intercostal arteries that have also some side branches. There are 3 side branches: collateral branches, lateral cutaneous branch, and a dorsal branch called collateral branch. Here it is the collateral branch. The collateral one that originates from the costal angle and supplies the structure of its intercostal space and the skin. Then the lateral cutaneous branch. Lateral cutaneous branch here. The lateral cutaneous branch, that is for the skin of the lateral and anterior part of the trunk. Then the last branch is the dorsal branch. The dorsal branch for the skin and the deep muscles of the back. They also have some branches that supplying the spinal cord as well. Now we are talking about the visceral organs. Visceral organs that supply the thoracic organs. There are 4 visceral branches from the thoracic aorta. First one, bronchial branch, mediastinal branch, esophageal branch, and pericardial branch. So first of all, bronchial arteries. Bronchial arteries, they enter the lungs through the root for the lungs of the pulmonary ileum and supply the lungs, the bronchia, and the viscera pleura with the blood. Then talking about the mediastinal branch, These are the many branches that supply many structures in posterior mediastinum, like lymph nodes, fibers, and tissue. Then the esophageal branch. The esophageal branch are the fourth to fifth small branches that supply the esophagus. The upper part of the branch communicates with the esophageal branch of the inferior thyroid artery. It also communicates with the left gastric artery at the lower part of the esophagus. The last one is the pericardial branch. The pericardial branch that supply the pericardium and together with the pericardial branch of the internal thoracic artery. And talking about the subcostal arteries, that is on each side, that below the 12th rib, that's supplying the abdominal wall. The 12th rib is known as subcostal arteries. At the last, this is the summary table for the parietal and visceral branches. So now we will talk of the visceral branch. In visceral branch, there are bronchial arteries, esophageal arteries, pericardial branch, and the mediastinal branches. The bronchial arteries that supply the bronchial lungs, there's esophageal artery that supply the esophagus, and the pericardial branch that supply the pericardium. And in mediastinal branches, they supply the post-mediastinal structures. Now, talking of the parietal, there are two parietal branches. First one is the posterior intercostal arteries, and second one is the subcostal artery. The posterior intercostal arteries, that is the 9 pairs from 3rd to 11th from intercostal spaces, and subcostal arteries, that area below 12th rib. The 12th rib is known as the subcostal arteries. So this is all of the thoracic aorta and its branches. Thank you.